is Dr. Tracy, and this is Salem, and this is my lovely assistant, Brandy.
Hi.
And we are going to talk about preparing your pet for the vet, specifically cats. Cats don't always like to go to the vet clinic, so there's a couple things that we can do to make their trip easier. First off, if you have a cat that has been super traumatized going to the vet, and we've seen this kitty before, just call us and we will prescribe some drugs for you to give at home and some canned food, just to take the edge off, kind of like drinking a beer or two. We specifically like gabapentin. Now, if you don't need to go that far, but you do want to lessen the anxiety, the first thing you're going to want to do is get your pet carrier out at home so the cat can sniff on it a couple days and get used to it. If you pull it out the morning that you're going to the vet, your cat will disappear and then you will not make your appointment. So have the pet carrier out. And you do want to bring your cat in a cat carrier. We have had situations where cats have gotten scared in the parking lot and jumped out of their owner's hands. Thank you, Salem. I love this cat. And literally been lost, like ran away in the parking lot. So always bring your cat with either a collar and leash and a carrier. If you don't have one, a pillowcase. It works great. We've also had people take 2 laundry baskets and zip tie them. That works. So, if you really want to prepare your cat for the vet and get an A+ for preparation, you can do some stuff, some handling of your cat in a certain way that's going to prepare them and let them get used to what it's like to be handled by us. So, this is the one time that you're allowed to put your cat up on your kitchen counter. You can actually put them on the counter and do just what I'm doing, petting them. And most cats are thinking they're going to get in trouble when they're on the counter, so lots of praise. The other thing we can do is kind of practice looking in their ears, stick a finger in there and kind of wiggle it around. You can practice touching their lips and opening their mouth and letting them get their face get touched, opening their eyes. Sometimes we take blood out of kitties' necks, so holding their chin up, stroking their neck, holding their little legs one at a time. One restraint that we do sometimes have to use, we use it as a last resort, and that's a scruff. That's how a mama cat would hold a kitten, and sometimes we have to do that. So you can actually gently scruff. As you can see, Salem is not distressed by this. Often, we will hold cats on their side. I've got a scruff, I've got back legs. Salem is actually loving this. I'm not hurting them, I'm even doing a gentle rock. We have this silly thing that we do called tapping to a kitty's head to distract them. You see Brandy just tapping the forehead. Sometimes we use a pen. That actually calms cats. And Salem just doesn't care about anything.
You know, he's very chill.
So if you have to restrain your cat at home, say to do a toenail trim, and that's something we encourage you to do, you can use these same methods. It's a 2-person job, but you can do the gentle on the table scruff, just rocking motion like this, while one person does the pedicure. Or you can do like a taco method, where they are wrapped up in a blanket, and you just pull out one leg at a time. This is actually a technique that we use frequently in the vet clinic to give shots. We will taco them up, hold them really close to our bodies, and give the shot in the butt. So cats feel safe when their head is covered up, and you don't need that, do you, buddy? What am I missing, Brandy?
I can't think of anything. I think that's really good. I think we could do anything to Salem, though.
Yeah, Salem is not drugged. He did not have any gabapentin. He just loves me so much. So, good job, Salem.